Welcome to Azad Bhai Academy. Today I will talk about diabetic retinopathy. Okay, diabetes is a metabolic alteration which is basically characterized by chronic hyperglycemia. So excessive blood sugar can alter your overall metabolic alteration, and that sugar can cause multiple problems. Among them, today's topic is diabetic retinopathy. Okay, diabetic retinopathy. Okay, that means the diabetes means excessive blood glucose. Okay, and retinopathy means retinal problem, retinal disease, retina. Okay, so I will not go into the details just regarding that means physiology or anatomy, but today's focusing point is retinopathy, that means pathophysiology caused by the excessive blood sugar. Okay, so roughly I will try to draw eyes to give you a basic idea about the retinal problem. Okay, so you can consider as a actually you can consider it as a eye, your eye. So this is ciliary muscle, and this can be considered as a lens. And I will not go into the details for iris or other component of the eyes. So main focusing, I will just try to draw here. This is this is scleral matter, and after that here some another choroid layer, and the main part of today's topic is retina, the innermost part of the eyes, which is very sensitive to the light. Okay, and why it is sensitive to the light? Just I will try to give you some basic, and then I will go to the pathophysiology caused by the diabetes. Okay, so this is the retina. Okay, and the inner part is you can just if I just draw a line that is light, then like that. Okay, so the middle of the retina can consider as a macula. Okay, so basic thing is, suppose this is light, source of light. You can think this is light, and that light will just reach to the retina. That light is electromagnetic signal. Okay, so your brain will receive only electrochemical signal. Okay, that means electromagnetic signal will turn into electrochemical signal. Electrochemical signal, your optic nerve are there. Okay, and that will reach to your brain. And how it is connected, I will try to explain. So electromagnetic radiation, electromagnetic signal will received by the retina, and then your connected optic nerve will be activated, and then a stimulatory nerve will just be active for the production of corresponding neurotransmitter, and that will activate the further neuron, and it will just reach to the brain, and brain will reflect the signal that what are you observing, what are you watching, what are you seeing. Okay, so I will just try to explain a little bit anatomy, because to explain pathophysiology something needed, okay, more to know about the retina. So come to the point here. So if I just zoom it in that way, so I will not go to the details, that is sclera and then choroid. I will just try to draw some choroid part, because choroid part carry multiple blood vessels which carry the nutrient and oxygen. Okay, that choroid, this is not part of the retina. After that, there's a brass border, but after the retina structure. Okay, so retina here, your pigmental epithelial cell. Okay, pigmental epithelial cell. You can say this is very sensitive pigment that will process the light, and it will carry a particular cell like that. You can say different types like that. These are rod cell or cone cell, you can say. So I can draw in different color here like that. Okay. So these are the photoreceptor. Photoreceptor. You can say rod cell, rod and cone cell. Okay. And then some horizontal cells are there. Okay, different name. I will not go to the details. So here can carry some blood vessels. Okay, and then here some bipolar cell. Bipolar cell, you know. Okay, and then again some horizontal cell, and it also carries some blood vessel. Okay, and then here the ganglionic cell. Okay, here is the ganglionic part. Ganglion. And the ganglion is carry the fiber, nerve fiber. You can think these are the nerve fibers. Okay, and after that it has a little inner limiting layer that will separate the aqueous vitreous from the retina. Okay, that will make a demarcation. And here some blood vessels there. Okay, so the components has another things in between, a very large, large glial cell, that is malar glial cell. The supporting cell, some microglia also there. So what are the basic things is that this inner limiting layer, the superficial layer is just reach of nerve fibers, and it is connected by the ganglionic cell layer, and that will just attach with the horizontal part, and then another cell, that is bipolar cell, that is connected with ganglion and the rod cell and cone cell by the another layer. Okay, so what would be the overall pathway? That is, your light will reach to the your light must reach to the photoreceptor, because it will receive the light. It will be activated, and it is connected with the optic nerve. Okay, over there, optic nerve over there. That's like that. Okay, so the pigmental substances that will just maintain the intensity of the light, which will just received by the photoreceptor, and then properly it will activate the optic nerve. When optic nerve will be activated, that means electromagnetic signal will receive through this way, and then finally it will activate the nerve. Then signal will reach to the brain. Okay. So what will happen? Our main topic is diabetic retinopathy. So just not choroid layer. This is not a part of the retina. From the retinal pigmental epithelium. So from this part to that part is the retina. So where problem may arise, by the excessive blood sugar. So different types of cellular components are there. The ganglionic cell, bipolar cell, the glial cell, the rod cell and cone cell, the epithelial cell, that is pigment epithelial cell, retinal cell. So all of the cells and has a major blood capillaries, that is very microvascular component, that is blood vessel. So the blood vessels are there, and there. The rod cell and cone cell has no blood vessel directly, but some by diffusion process from the choroid blood vessel the rod cell and cone cell can just receive nutrient and oxygen. Okay, so where the problem may arise, that is, one is blood vessel. Blood vessel of the retina can be affected. Okay, blood vessel. And the second one is the retinal cell. So which retinal cell? All types of retinal cell may affect. How it will be affected? Just now come to the point. So this is the basic of retina and retinal structure, and now I will come to the retinopathy, that is pathophysiology. Okay, so the main problem will be arise in your blood vessel and retinal cell, that is retinal cell. So retinal cell, the major one of the component is the pigmental cell, and already I said rod cell, cone cell, and all other glial cell and amacrine cell, different types of cell. Okay, so now come to the details. Suppose you think your blood sugar level is high, that means excessive blood glucose. Okay, then what will happen? Suppose this is a cell, and you can think this cell can be your endothelial cell from your blood vessel, the innermost part of this is endothelial cell, composed by endothelial cell, or other retinal cell you can consider. So when your blood glucose is excess, so what will happen? Excess blood sugar will enter in your cell. Then what will happen? Normally, sugar, that is blood glucose can turn into ATP by glycolysis process with the presence of oxygen. Okay, the sugar, acetyl-CoA, pyruvic acid, and then mitochondria, then ATP. This is the normal process. What will happen when the excess sugar just enter into the cell? That excess sugar will turn into sorbitol. Okay, sorbitol, and it will be influenced by an enzyme, that is aldose reductase. Okay, and then what will happen? Again, it will produce just by the enzyme sorbitol dehydrogenase, and it will produce fructose. Okay, and that fructose can turn into glucose and any other that will enter into the metabolic pathway and produce energy. This, you can think, this process is also normal. In normal range, it can happen within the cell. But when it will be more, excess blood sugar will enter, then what will happen? That reaction will be excessive. Okay, so aldose reductase will make the sugar into sorbitol. Okay, and then here one coenzyme is used, that is NADPH. Okay, that can be so-called antioxidant coenzyme, because this one is responsible for producing glutathione. Okay, and the glutathione is a strong antioxidant. Okay, so normally glucose will just go into the normal pathway by glycolysis to produce ATP, but when it will turn into sorbitol, then it will use more NADPH. Then what will happen? Glutathione production will be inhibited because that coenzyme is used over there unnecessarily, and glutathione, for the production of glutathione, NADPH is very important. Okay, so what will happen? This NADPH coenzyme is used here, so antioxidant will be reduced. So what will happen? Free radical will be higher, so oxidative stress will produce. Another thing is that sorbitol itself is one of the major culprits to produce different types of problem. What will it will produce? So you can think here sorbitol, and that sorbitol actually creates some problem. The pathway already used the NADPH, the glutathione production is just going down, and then your free radical production, of course, it will be hampered, and then the free radical will be higher, free radical, and glutathione, that is antioxidant, will be lower, antioxidant. So this condition is oxidative stress. Okay, so this is one problem. And the sorbitol itself is a culprit, already I said. So that is sorbitol is just, it will work as a osmolytes. That means it will increase the osmolarity within the cell. Okay, that means it will attract the water from outside to inside. Okay, so water will enter here. Water. Then what will happen? It will create some problem. The cell will be swell up, and within the cell, the sorbitol will create some problem. It will make the dysfunctional organelles. That means protein, misfolding protein will produce, and it will increase the osmolarity within the cell. It will make the cell dysfunctional because the internal condition is completely hampered. The homeostatic condition is hampered by the sorbitol. Excessive sorbitol is just produced by the excessive blood glucose. Okay, that means diabetic patient, when the diabetic patient will carry excessive blood sugar, and that will excessively enter into the cell, and that will cause excessive produce excessive sorbitol, and that will cause osmolarity change, and it will swell up the cell. It will hamper the internal organelle or misfolding the proteins. It will hamper the antioxidant production. It will increase the free radical formation. That sorbitol will cause some problem of mitochondria, and that mitochondria will be dysfunctional, and that will produce excessive, that will leak the excessive free radical, and that will cause antioxidant. Okay, so one culprit we already identified, that is the sorbitol. Okay, and that pathway, the glucose to sorbitol, that pathway is called polyol pathway. Polyol pathway. Okay. So that sorbitol can produce within your endothelium. Okay. It can be in your retinal pigmental cell. It can be in bipolar cell. It can be in your ganglionic cell, or it can be your glial cell, or horizontal different types of cell. Okay. So different places that may happen, and that will produce the dysfunction of the corresponding cell, and that will create problem. Okay. So another one is another culprit is AIDS. Second one is AIDS. that is advanced glycated end product. How does it mean? That is your blood glucose will just bind with protein and lipid, and that will create a third product that is called AGE, advanced glycated end product, and that is very glue-like adhesive-like substances, very sticky, and that may produce within the cell or your extracellular space that will produce. And the extracellular space carry collagen substances, and that will produce that age can create problem with the collagen. And within the cell, your protein organelles or fat substances, when sugar will enter, and that age can produce also within the cell. And where it can produce? It can produce throughout the retina. As like I said, in your blood vessel, endothelium, your pericyte, the blood vessel is wrapped up like that, astrocyte in your brain. The astrocyte is just wrapping up your blood in your brain blood capillary, okay? And it will just act like a blood-brain barrier. Here, that retinal blood vessels also wrapped up by the pericyte, a special type of covering-like substances. That is this is the pericyte. Okay, that pericyte can also be hampered by the sorbitol or age. Okay, so age can also form in endothelium. Age can form in your pericyte. Age can form your glial cell, that's in pigmental cell, rod cell, cone cell, or your ganglionic cell within the retina. So what will happen? That age, already I said this is a glue-like substance. The age can bind with age receptor. Age receptor. And it will activate the pro-inflammatory pathway. It will activate the pro-inflammatory substances, and it will cause inflammation. Okay? That age can bind, it can form within the endothelium, or it can bind the extracellular portion. The endothelium dysfunction will occur, and when endothelium will be activated by age or attacked by age, there also free radical will produce. And if the age is just attack in the basement membrane here, basement membrane, not here, this is also a smooth muscle. Here, this basement membrane can also be sticky. Okay, when age will just aggregated, and the basement membrane can be sticky or very thick. Okay, so pericyte will be activated by age. What will happen? So pericyte can be affected, your basement membrane can be affected, endothelium layer can be affected, the blood vessels. So this is the muscular problem. Okay, and age can form in your retinal pigmental epithelial layer, that is your pigmental layer. That can also cause in photoreceptor, that is rod cell or cone cell. It can be bipolar cell, it can be ganglion cell and glial cell and so on. So if such type of cells can be dysfunctional by forming age and sorbitol, then what will happen? The light will not properly just absorb or not properly pass through the whole way to activate or to receive by the photoreceptor, rod cell and cone cell, and it will not be properly justified or properly processed in the pigmental layer, and that will finally affect the optic nerve. Okay, so what are the problems? What problems may arise? Okay, if such type of age and sorbitol, the major two culprit. So age, when age formation, age can also create some problem. It will aggregate, sorbitol can accumulate, and it will make the dysfunction of endothelium, pericyte, and then finally what will happen? It can aggregate and it will produce inflammation. Then what would be the end product or end or the outcome, final outcome of that age and sorbitol to produce to make the retinopathy? What will be the role? Okay, so now come to the point. So already I said the main two culprit there. So now how it will damage the retina? Now I will try to explain. So if you think the retinopathy, that is diabetic retinopathy, retinal problems, is basically caused by, you can say this is a vascular problem. The retinal blood vessel is basically attacked. Other cells, retinal cells also actively involved, but mainly you can say there is the vascular problem. Okay, so what will happen if those substances will attack in your, suppose it can be damage your pericyte. Okay, so what will happen if pericyte damage? Then permeability can increase. Okay, if the blood vessel permeability will increase, so what will happen? Blood flow will decrease to your basement membrane may be more thicker, may thick, and then 3, it will produce your endothelial layer dysfunction. It can create the deformation of the blood vessel. When your pericyte will be damaged, your basement membrane will be thick, then your blood vessel will be deformed like that. So what would be the terminology for that? That is aneurysm. So you can say micro aneurysm. Okay, that can form within your retinal blood vessel. Also, your blood vessel can be leakage. Okay, sixth one is it can cause hemorrhage. It can cause some clog, or you can say it can produce some plaques like that. That is, it can increase the permeability by damaging pericyte, and it can harden the basement membrane, and it will decrease the blood flow. It will create some problem of endothelium, and that will create some plaque-like condition, and that will cause, this is called, you can say, ischemia. So ischemic problem arise. Then what will happen? If ischemic condition happen, then the rest of the portion will not get proper oxygen and nutrient. Then what will happen? That blood vessel will be, particular part of the blood vessel will be activated, and it will produce endothelial releasing growth factor. Okay, endothelial releasing growth factor. Sorry, vascular endothelial growth factor. Vascular endothelial growth factor. Then what will happen? It will activate the blood vessel to produce more blood vessel. Okay, that is neovascularization. That is angiogenesis. Okay, so such type of problems may happen within your retinal blood vessels, then what will happen? Actually, when blood vessel will leakage, exudation will happen, excessive that means from the blood vessel, different types of protein and other substances will come out from inside to outside, and it will aggregate and will produce exudates. You will just see the hard exudates. Okay, it will just create some. You can say this is wool like cotton wool like spot. Okay, so what will happen? Another problems, that is your blood vessel is making vulnerable by forming sorbitol and age, and that age and sorbitol will hamper the intracellular organelle function that can dysfunction the mitochondria, and mitochondria will just leakage, and it will produce the free radical will come, the peroxide, superoxide will come from the mitochondria, and it will increase the free radical will increase inside the cell. And already you know the antioxidant glutathione production will decrease by the sorbitol formation. The NADPH, that is coenzyme, which is already being used for sorbitol formation other than pathway. So free radical will increase. Then finally what will happen? Oxidative stress. And oxidative stress condition is always challenging for survival of a cell. That means a cell can die, cell can damage. Okay, so the vascular problem may arise, and then it can create hemorrhage, it can cause aneurysm, the dysfunction, the deformation of the blood vessel, and ischemia. That ischemic condition can accelerate the neovascularization. Okay, so these are the problems. Okay, and all the problems are associated with blood vessel of the retina. In that case, you can say the retinal diabetic retinopathy is basically a muscular problem. Okay, so another things, all those substances we can just produce in retinal cell. Already I said retinal cells. What are the retinal cells? Already I said several times. That is your pigmental cell, endothelium cell, sorry, epithelial. You can say your rod cell and cone cell, that is photoreceptor. You can say the glial cell, bipolar cell, ganglionic cell. If that type of cell will swell up or dysfunctional, or your inner protein folding will be misfolded, and that will create problem. So all the other cells of the retina will be affected by the sorbitol and age. Okay, suppose if you think your just middle part of the retina, that is macula. If macula is affected, then macula will be swell up. That is macular edema will produce. Okay, macular edema. So what not actually? So this is the vascular problem. Other problem is there. So if I just try to differentiate some factors, then we will find out a main difference. That is called, we can categorize the diabetic retinopathy in two different types. Okay, so what are the types? So types is basically diabetic retinopathy is two types. One is proliferative, non-proliferative. One is non-proliferative diabetic retinopathy, and another one is proliferative diabetic retinopathy. So if I just try to explain, then all other the characteristics, that is, you can say loss of pericyte, increase the permeability, thickening of the blood basement membrane, that is endothelial dysfunction, that can create the inflammatory problems, that can produce microaneurysm that can cause exudation, that can cause hemorrhage, that can cause leakage, and so on. So all of the things can happen for both cases. All the things can happen in both cases. But what is the main difference? Main difference for proliferative retinopathy. It should be written here. Proliferative retinopathy. One characteristic is different. That is neovascularization. That is angiogenesis. Angiogenesis. This is completely associated with proliferative retinopathy. Okay? Proliferative retinopathy means in your retina, the blood vessels will produce excessive branches like that. That is, new blood vessel will form. Okay? So if you just try to watch in microscope, it will be visible excessive more blood vessels. That is called neovascularization. And this is basic criteria of proliferative diabetic retinopathy. And other things, if you think the dysfunction of the aneurysm, microaneurysm, exudation, or you can say hemorrhagic condition, ischemic condition, all other all other symptomatic things may happen for non-proliferative retinopathy, also proliferative retinopathy. Some early stage or development stage or severe stage, it can happen in both cases. Okay, but neovascularization, you can think neovascularization, that means new blood vessel formation, that will proliferate more, that is the proliferative things. Okay, so this is all about diabetic retinopathy. That means when someone will be suffering from diabetes mellitus, he or she will carry excess amount of blood sugar. That blood sugar itself is not a problem, but blood sugar can bind with other substances, that is lipid and fat, and that will produce the third product, that is ACE, that means advanced glycated end product, and that is the culprit of the matter. That will decrease the blood flow, already as ischemic condition, because it can inhibit the endothelial releasing growth factor, the proliferative factor, that means nitric oxide. So if nitric oxide production will be inhibited, then blood vessel will not be dilated, that is contract. So blood flow will decrease. Okay, so ACE is one of the major factors. ACE will create thickening of the basement membrane, or it will deposit in the endothelial layer of the blood vessel. It can produce proliferative substances, inflammatory substances, and that can cause inflammation. And sorbitol, already I said. So the blood sugar will produce excessive sorbitol and ACE. And these two things are basic culprit for causing diabetic retinopathy. Okay, so this is all about diabetic retinopathy. Thank you very much.